Welcome to our webinar we're holding tonight on behalf of Health Education England. This is all about out of programme for pause. So I hope it'll be good and enjoyable and informative. And we've got some really good speakers on tonight. So I hope you'll enjoy it. And rather than me bore you by introducing them, I'll get them to introduce themselves. I will start by introducing myself. So my name is Adrian Brooke. I'm Deputy Medical Director at Health Education England. I'm now going to hand over to Jonathan.
And I'm Jonathan Corn. I'm the Postgraduate Dean for the East Midlands, and I've been involved in developing the UTP policy post-COVID. And I will hand over to Bill to introduce himself.
Good evening, I'm Bill Allen. I'm a consultant upper GI surgeon, but I've been chairing the Academy of Medical Royal College's Flexibility Working Party and have been involved with the out of programme pause with regard to its assessment. And I'll hand over to Victoria.
Hi, I'm Victoria. I'm an ST4 anaesthetics trainee in the East Midlands Deanery. I have recently completed an out of programme pause, so I shall be giving my experience on that. And I'm going to hand over to Kaya to introduce herself.
Hello everyone, my name is Kaya Coxa. I'm one of the core anaesthetics trainee just in the end of my core training. I finished my out of programme post a couple of months ago, and I'm here to talk about my experience with out of programme post. And I'm going to hand over back to Adrian Brooks.
So what we're going to do now is I'm going to hand over to Jonathan Corn, who will take you through an explanation of what out of programme pause actually is. Jonathan.
Thank you, Adrian. So I just want to give you a little bit of background about out of programme pause, a little bit of detail of some of the process for applying for it, and then hand over to Bill, who'll talk a little bit about the gap analysis, which I'll explain in a minute. So basically, out of programme pause came from a desire to increase the flexibility in postgraduate medical education. It is seen as a little bit of a treadmill, that once you get on at the beginning, you're stuck on it until the end. And the idea was that actually some of you just require a little bit of a break for training, not necessarily for a specific reason, not necessarily because of domestic issues or because you're becoming an Olympic sports person or you want to do research, but simply you just want to do a job, work, and come off the kind of training treadmill. And UTP was really designed firstly to allow you to do that, but secondly, so that when you came back into the training programme, any kind of competencies you'd gained during your UTP, during the work you were doing during UTP, could be assessed on your return to the training programme and then counted towards your CCT, so that the job you were doing wasn't completely wasted from a training point of view. UTP really is designed for people who want to do a patient-facing role in a UK-based organisation, but it doesn't have to be restricted to the NHS. So that was the idea, and it was piloted in the East Midlands actually a couple of years ago, and you're about to hear from two people who've done that. But when COVID came, we felt we felt there may be many more of you who felt you'd benefit from doing an UTP, just because of the kind of experience you've gone through and the huge amount of additional work you've been doing. And we wanted to make it available across England as part of our offer, if you like, to you as trainees who've been really working extremely hard indeed under very, very stressful conditions over the last few months. So that's what today's about, making UTP available for all of you in all specialties. I'm going to kick off with the first slide in a minute, which is about giving you the detail of UTP, but I'll say two things beforehand. When you come to consider whether it's what you want, it is important to think about whether it's the best thing for you. So I talked about one of the reasons for bringing it in was to give people a break and a rest after a really very stressful time. And one of the things we've encouraged you to think about if you're going down that route is to talk to your educational supervisor about the reasons you feel you need to do it. It might not be, if you've just gone through a really stressful period and you're suffering consequences as a result, it might not be the best option for you. And more importantly, there may be other support that we can give to you. So have that discussion with yourself and with your educational supervisor. And the other thing, before we get to the detail on the slides, is that, as I say, it's basically any patient-facing UK job-based job can be done during your UP, but have a think about the job you're going to. You know, what would make a good job to do in UP? You may get a job in an NHS hospital that's established as a training site, and that would be ideal. You may want to work in the private sector or the charitable sector, and have a discussion with your educational supervisor as to the competencies you're likely to gain, the supervision you're likely to have, and the kind of governance arrangements that there will be at the place you're working. And that might not be obvious, but what I would say is do a little bit of research beforehand. So those are the, I think, crucial general points. Just to go to the specifics, and I will hopefully get through this fairly quickly, and hopefully the slides are now up and you can see them all. The first thing is, when it comes to eligibility, as far as UP is concerned, essentially it's the same as UP in general. You need to be on a satisfactory training trajectory, which usually means having an outcome 1. Though of course during COVID we've had these additional outcomes of 10.1 or 10.2, and as long as you've got a 1, 10.1 or 10.2, you will be suitable for UP. As with all UP, just so the training programs can manage, we do ask you to give 6 months notice. However, one of the things that may be the case post-COVID is there may be actually not enough capacity in some of our training programs for those people that want to extend or those people that need extra training time. And you may find, if you talk to your local office, that actually you can give much less than 6 months notice, because there will be a trainee who would be very keen to take that post. And then when you are on UP, for exactly the same reasons, keep us informed of any changes to your plans to return for training. This is a pilot, and it's an extension of the pilot. The pilot finishes on the 1st of August 2021. So applications can be made anytime up to the 31st of July. And I should add that it will be evaluated, your experience will be evaluated. So when you do come back, Cardiff University are evaluating this and will probably get in touch with you. If we can move to the next slide. So just a little bit about the return process. What we're asking is that 9 weeks prior to the end of your UP post, you make contact with your educational supervisor to confirm the date that you will be coming back to your training programme. You cannot, in this pilot, take UP for up to a year. It doesn't have to be a year, and if you've taken it for less than a year, you do have the option of extending that, so you may want to discuss that with your educational supervisor. And Bill Allen is going to go through the paperwork you need for the gap analysis, so I will jump over that, but part of the meeting is to make sure that the paperwork you have to have prior to the gap analysis is completed. You'll then have your initial educational appraisal meeting with your educational supervisor. The details Bill will cover, but it's essentially looking at what competencies you may have gained and what competencies you need to gain in the following years of your training programme, and that will form the basis of your training plan. If we move to the next slide. And then, as we said before, and Bill will explain more, once you're back in programme, that will be the opportunity you have to demonstrate the skills and capabilities you've gained, and for them to be assessed, and for a discussion to take place, and for an ARCP to take place about how that's going to affect your CCT date, and a formal determination of that made at your ARCP. There is a how-to guide that's going to be published. It has actually a very nice infographic which talks you through the whole thing, and I would urge you to look at that as soon as that's out. So I'm going to now hand over to Bill, who's going to talk about the gap analysis.
Thank you, Jonathan. Helen, can I have the first slide, please? Thank you. The background to this is that the Academy was approached by the GMC 2 or 3 years ago, largely looking at some of the issues that came out of the industrial action relating to the junior doctor contract. And one of the key issues that came out of those discussions was the feeling that, as has already been pointed out, the treadmill is not something many trainees are happy with. And there was a key issue of trying to find a way of flexibility to enable trainees to have control over their trajectory of travel as they work their way through their specialty training. And there was a sizable working group that was fully represented from all colleges, together with the GMC and the statutory educational bodies of ATE and equivalents in the other 3 developed nations. And it worked its way through a series of scenarios relating to what opportunities for flexibility there should be in postgraduate training. At the time of our deliberations, the UP programme was being considered, and it seemed absolutely essential that this was something that we included within this guidance, which we published last month, which goes into a lot more detail of the background to flexibility. But we've taken on the issues around UP and included it within this document. And for all of the various scenarios we've considered, it's necessary to have a gap analysis to work out what is appropriately learnt during these times out of programme. Next slide, please. Now, a gap analysis is a term that covers a variety of things, and you can go into education literature and find out all sorts of definitions. This is the one that we've used. It covers 2 specific areas, because we in the flexibility work have looked not only for doctors in training, but for those doctors not in training posts. And this includes for those who wish to change specialties or those who wish to join a specialty having been in a non-training post previously. But it makes absolute sense that this process should be included within the UP programme as trainees return into programme, having spent their time working as Jonathan's explained. So as you can see, it's very much working out what's been gained previously, what's been gained during your time out of programme, and how does that fit with the curriculum that you're returning to. Next slide, please, Helen. Now, the gap analysis is broken into 2 parts. The first part looks at what will be the standard information that is part and parcel of the ARCP forms, namely the personal details and training to date. Next slide, please. So when you are looking to go on an UP, it's appropriate to understand what capabilities you all have already gained, and to a certain extent you'll have done this in preparation for your ARCP. And in particular, not only looking at the specialty specific ones, but also the generic ones relating to generic professional capabilities. This is something that I think is going to be more prevalent in the coming months as we go into the new design of curricula on a high level outcomes basis. And so it's important in the first part of the gap analysis tool to record those experiences you already have and to make sure that it fits with your training trajectory. Next slide, please. Now, the second part of this slide actually then returns to look at what you have achieved during your out of programme experience and to set that against what is going to happen when you go back into programme. For example, if you have come out of programme at an ST4 level, you'd be expecting to go back in at ST5, and it's making sure that you're up to the trajectory for the ST4 requirements, i.e. you've completed the ARCP for ST4, and it's what's required from ST5 in the curriculum as you return, in addition to take into consideration what you gained out of programme. Next slide, please. So the key to this is that you should be very careful in recording those capabilities and competencies that you have acquired during your out of programme. This may be clinical, it may not necessarily be clinical, and can include other areas of experience, such as in management, administration, and other aspects of developing an educational portfolio. So by recording these carefully, you are then best placed to have the conversation with your educational supervisor when you return to programme, so that firstly, these are carefully documented. Secondly, they can be compared, i.e. the gap between where you have been and where you are now, in relation to the specialty curriculum that you are in. So it's important that by keeping a careful record of what you've achieved, your educational supervisor can see and assess that gap. Now, what will then happen is that the learning agreement will be put together for the coming period of training, and there will be a provisional outcome from the gap analysis as to where you are on your trajectory. It is important to appreciate that those capabilities that you would like to have assessed and considered as part of your training trajectory are then assessed in a relatively short period of time in your new post once back in programme. So in other words, not only will you set your learning agreement for the requirements of the curriculum for the coming year, but in addition, it will be appropriate for you to be able to demonstrate the capabilities you're going to add out of programme, as they will inform the ARCP process. So in other words, once the gap analysis and the learning agreement is established, being provisional, when you then go for your ARCP at the end of the training year, whether or not those capabilities going out of programme are recognised will be signed off at the ARCP process. So the intention is that not only will you gain the necessary additional experience in and out of programme, it may well affect what you then need to learn in the coming year or 2 years of your remaining training, for example, because it may well be you've gained sufficient experience that you've covered some aspects of the specialty curriculum that you do not need to repeat. I'm going to leave it there, and I'm going to hand over to Victoria, who's going to give you some insight into her experience out of programme.
Thank you very much. So I'm now in my ST4 year of my anaesthetics training in the East Midlands Deanery, and I took my UP at the end of ST3. I was quite unwell and ended up being off work, unfortunately, for 6 months at the end of my ST3 period, and had quite a long phased return back into working. So when it was coming around to actually getting back into things, there was a bit of trepidation there that it would be going straight back from getting well again to adjusting to work and then having to go into revising for my final FRCA. So when I think it was one of my college tutors and also one of the regional advisors suggested the possibility of having this UP, it sounded like a great idea. So I took it basically as a breathing space. The idea was to get back into again fully working after my phased return, really get back into things, adjust, because I also then decided to go 80% less than full time. So to get to adjusting to, I do apologise, my little dog's barking. He's been so good all day and now he wants to bark. I do apologise. So yes, to adjust to my work-life balance, working as a less than full-time trainee, and just really focus on sort of getting back into medicine and enjoying it again, because as the phrase has been said by many, it has felt like I was on a treadmill with training, and after being unwell, it did make me take stock of things slightly and realise that it had just been snowballing and snowballing, and the idea of just getting my health back and then potentially going into a chaotic working, revising, doing all the extras that of course we have to do, like audit our assessments, just seemed quite a lot. And as I said, it was a great breathing space. it was actually really easy to organise. I filled in a form alongside chatting with my educational supervisor, training programme director, and actually had some occupational health backing as well, because my reason was, one of the reasons was to sort of get back in after being unwell, and had it approved very quickly. I started it at a slightly random time in October of 2019. The plan initially was to do a 6-month EP and reassess, but actually I got back into things really quickly, found that taking that pressure off really did make me enjoy medicine more. I actually found I was really enthusiastic, was getting things signed off, almost unpressurized, wanting to catch up for the time that I had been off. Not that was at all a factor, but I just rekindled my enthusiasm for it. I did some teaching. I actually wrote an article as well, and because it was all going so well, I asked if I could shorten my EP to fall back in line with the sort of 6-month changeover with anaesthetics. It's February and August, and that was all approved. So after 4 months, I started back officially as ST4. And yeah, it's been great since. I've got some colleagues currently who are doing a pause for different reasons. Some of them, again, are looking for a bit of breathing space, either having exam difficulties or other personal reasons. And they've all said the same. It's really nice just having the pressure taken off, so that you can, almost a bit like a service provision doctor, but you still have all the benefits of being a trainee, in that you've got the protection. You still get to attend teaching, and if you want to get things signed off or try and get on a list, people are more than well, from my experience, have been more than willing to help with that, and to make this time count, as well as giving you that breathing space. So I would really recommend it to anybody who does, if just need that space, either because of other circumstances, or if it has just got to the point we talk about burnout a lot nowadays. And I think just taking that pressure off can really help with that. It makes you enjoy your job and do your job as you do during the day, not with all that other, the other things in the back of the head going, oh, I need to finish this audit, am I behind in my case numbers? All of that goes away and you just enjoy your job. So I would really recommend it, and my experience has been very positive, very easy to do, and yeah, so I'd recommend it. I'm now going to hand over to Kaya, who's going to talk about her experience. Thank you.
Hello, so I'm Kaya, and I was asked to talk about my experience with out-of-program POS. So currently as I mentioned, I'm in the end of my core anaesthetic training, and everything started by the end of the October 2018. At that time, I started my CT2 year, and I was just about to sit my primary anaesthetic exam in November, so I was during the revision time, when I unexpectedly received a phone call from home is in Poland, to receive the most devastating news that my father has become acutely unwell and required an emergency surgery. At that time, the hospital I was working at was very supportive. They organized some emergency leave, which allowed me to go back and spend some time with the family. My dad is a pretty fit person, so he recovered really well. So after a few days, my parents made a joint decision that, Kaya, just go back to UK, carry on working, pass your exam, and carry on with your anaesthetic career. So I returned about 5 days before the exam and decided to sit the exam, despite knowing deep inside that that probably wasn't the best idea. Obviously, I failed. I felt really sad about the entire situation, and I was as well worried about my family back at home. So I organized a meeting with my educational supervisor to discuss the options, where we are going from this place. During the meeting, as a part of our usual meetings, we were going through my portfolio, and I realized that well, it became quite apparent that I haven't completed any assessments since my father became unwell. So I became untrainable. We started to have a chat about the possibilities. We discussed the less than full-time training or maybe a career break. However, I really wanted to carry on working because it's, first of all, it kept me going. It was a structure to my day. Secondly, I needed a regular income, not only to provide for myself, but also to support my family. Just if my father wasn't able to return to his usual employment. The other option we discussed was training extension, but that would take to sort out a couple of months. And lastly, my educational supervisor mentioned the idea of out-of-program posts. It was introduced to me as a new type of break for trainees with their various situation, sometimes a difficult life situation. And the aim was to take the pressure of training for the period of, we agreed for 6 months. Well, it sounds really good to me, and we decided to pursue that course. Similarly as Victoria, I was referred to the occupational health just to assess the situation and to find out if there's any more support needed. The occupational health was really, really keen for me to apply for the out-of-program post. We also involved TPD, and jointly the application was sent. After a couple of weeks, I found out that my application was accepted and a placement in a local hospital was organized. As per suggestion of my educational supervisor, as well as occupational health, I've been referred to the professional support unit to look into the cause of my exam failure. There was the obvious factors such as stress, distraction. Probably I really needed more revision as well. However, I failed the exams before, and we really want to explore that area. So I received regular meetings with the tutor, and on one of those meetings, she suggested that maybe we should do some further assessment and some psychological tests. After those, I found out that I'm actually dyslexic. That was a turning point in my studying technique and my revision. So what happened is they introduced me to the absolute way to revise. My tutor also emphasized the need of mindfulness, well-being, and rest. I changed my daily routine drastically, and as I was gradually improving, I was able to offer more support to my family. By the end of 6 months, because that's how long my out-of-program post was, I felt ready to return to training. During those few months, I was able to assign some of the modules, got assessments, and shortly after my return, I passed my primary anesthetic exam. So my out-of-program post was not only a breathing space, it was a recovery period, but also a major transformation. I have very positive experience with out-of-program post, and I really, really recommend it to anyone. Thank you so much, and I'm going to hand over to Jonathan Cron. Thank you.
Thank you very much, Kaya and Victoria. Those are really honest and open descriptions of your OOP experience, and I think really good adverts for OOP. So thanks very much indeed. There are a few questions that came in before the session that I'm just going to deal with now, and then I'll hand over to Adrian, who will hand out, I suppose, the Slido questions to us all. The first question we had was essentially about the difference between OOP and OOP-C. And I suppose there are a couple of differences. The OOP-C is usually for a specific reason, like a domestic reason, like you want to pursue something outside medicine, such as competitive sports or something like that. So you wouldn't normally be expected to work during an OOP-C. And of course, if you did work, you couldn't count those competencies. They could not be assessed on your return. Whereas an UP, you don't really need to give a specific reason for that. There's not a list of reasons in the Gold Guide why you can take an UP. It will be for, as I say, just because you want to go off the training treadmill. And of course, the really important difference is that when you return to your training, those competencies you feel that you have gained can be assessed and hopefully counted towards your CCT. There was a question on Slido, Adrian, I hope you don't mind if I answer that now because it fits in quite nicely, which is about the difference between an UP and an UP-E. An UP-E is experience that you gain outside your training program, so it's not usually essential to, or not necessarily essential to the curriculum. It's an experience that your training program cannot provide, and it would not usually count towards your CCT. Whereas an UP, the training that you do get, or the experience you do get on an UP, can also be provided within your program. You're not doing it because you need to gain that experience outside your program. You're doing it simply because you want to pause, and I think that's an important difference. Someone asked whether UP must be for a year only, or can you request 6 months? And it's basically up to 12 months. So any period up to 12 months you can apply for. Someone's asked whether it has to be taken within an NHS institution. It has to be patient facing, and it has to be a UK institution, but it doesn't have to be an NHS institution. Now, the advantages, of course, of an NHS institution is they're usually established training sites, so they're used to educational and clinical supervision, and you would just probably slot in next to existing trainees. But it doesn't have to be an NHS institution. It can be a private provider, can be a charity provider. Part of the discussion you'd have with your educational supervisor prior to taking UP is the appropriateness of the placement that you've chosen. Final question that we had before the session was about whether you can change deaneries whilst you're on OP, really referring to IDT. The answer is you can only actually change whilst you're back in the programme, but you can apply to change whilst you're on OP. So as long as the IDT happens when you're back in the programme, you can apply to change whilst you're on OP. Those are the questions we had beforehand. There are a lot more coming in, so I'll hand over to Adrian, who's just going to chair the final kind of question and answer session.
So thank you very much. So I would reiterate, thank you, Jonathan, for that, going through those questions which we received ahead of time, and thank you to Victoria, and thank you for Kaya for those fantastic contributions. I think they tell the story of why it's a good idea much more eloquently than we can actually. So we have got some questions which have come in on Slido, and I'll start by apologising to say I think there was some issues getting people invited onto the webinar at the very start. So if you have missed any of it, don't worry, we are going to record it and it will be on our social media channels, so you will be able to pick up any bits at the start if you weren't able to get in right at the beginning. So we have got questions coming up. I'm going to show my terrible ability to manage technology now, and probably not get these questions quite right. So I think we did have the question about the difference between OOP and OOP, and I think that's already been answered, which I think is really good. I think we have got a question for Victoria, which I'll kick off with, which was, it says, Victoria, having returned after 4 months, are you enjoying your training job as much as you were?
I can happily say yes, I am. Obviously with COVID things went a little bit awry. And I'm now revising for my written final, so possibly not as much as I was, but that's exam. But it's definitely put me in a much better place than I think I would have been just literally getting back into things and having to do all this straight away. So on the whole things, yes. But I'll be glad when I pass my final and it's all done.
Okay, that's great. Thank you so much. So we'll return to the first question. I hope I get the order right here. So there is a question about out-of-programme pauses described in the junior doctor contract, where training has been affected due to external circumstances. like a public health emergency, is this unrelated? Jonathan, do you want to have a crack at answering that, please?
Yeah, and I suppose the answer is yes and no. As I started off, I mean, it is important that UP is seen as a opportunity to get a break from your training, and we've heard about some of the reasons from Kaya and Victoria why that's helpful. But undoubtedly, what we realised post-COVID is that many of you might not be able to get the competencies you were hoping to gain because of the disruption due to COVID, and because UP is a way that any competencies you gain whilst working can be counted. It certainly can be used for that, and is one of a suite of measures we've brought in to make sure that we can mitigate as far as possible issues with competencies. So gaining competencies while working outside the programme is one way of one of our measures. You'll know the whole change between the addition of the 10.1 and the 10.2 for ARCPs is another measure we've brought in. So I would see it primarily as a way that you can take a break from training, but also as one of a suite of measures by which you can mitigate against the effects of COVID and the disruptive effects it's had on your training.
Okay, thank you. That's great, Jonathan. Thank you for providing that answer. So our next question is about who's responsible for organising the clinical outer programme pause post. Is it the trainee? And does the post need to be sorted before the outer programme pause can be approved? I can have a go at that, but Jonathan may want to start off. Jonathan, over to you.
Excellent. I thought also actually Victoria and Kaya might be able to describe how they organised their posts. It's a discussion essentially. So you may have posts that you wish to do it during your UP, and I would encourage you discussing those with your educational supervisor, who may not know the posts themselves, but may be able to guide you from the information that's available on their suitability. It may be that your educational supervisor knows you want to take UP or P, or one of your clinical supervisors, and can recommend posts. The UP is for someone that wants to work, so you do need to have applied and got, you do need to have got your post when you're applying for UP. But it's a kind of iterative process, so you would start talking to your educational supervisor and kind of getting an idea of whether it's the right thing to do, and then start looking at the posts that you were thinking of doing. I think is probably the way you do it, but I'm sure Kaya or Victoria can tell us how it happened in real life, and then Adrian can tell me that I'm wrong.
Okay, so from my experience, the idea of out of program posts came from my educational supervisor, as I mentioned. And then there was a long route of discussion between the training program director and educational supervisor. And I think that my post, so we chose to place, I mean, my post consisted actually of my 6-month post consisted of 2 placements. So first 3 months, I spent it in the maternity, where my education supervisor actually is working. And the second, I rotated into intensive care, to the unit where I worked before, and I had really good working relationship with all the staff working there. So I think it was partially on purpose, looking backwards, but those posts were not chosen by me, they were suggested, and I was very happy with that choice.
That's a really good illustration. So I think the key here is discussing what your needs are, and it is important that you go into posts where you are going to be safe, because you've got to be safe for you, and we don't want you to be doing stuff which you don't feel happy doing, because it is supposed to be a pause from training. And clearly, if you've got access to people who are able to supervise you, and we'd hope that all clinical positions where you're not a senior doctor, as it were, there will be supervision. So there is a safety element that I think we have to be aware of, and that the key there is the discussion with your educational supervisor or a training program director to really kind of work out what's best for you, and what's best for your kind of where you are in your journey. So I think we'll move on now. So there is another question which I think hopefully we can sort out. So there's a bit of confusion. Someone's a bit confused because they say, do you stay in the post that you're supposed to be in? And I know we've got some exceptions here because we're very early on in the phase of the pilot. But if we'll hand over to Victoria, and then I will come and in the nicest possible way expand and possibly contradict what Victoria's about to say.
Thank you. So in my case, I did actually stay in the post that I was going to be in. After discussion with my educational supervisor and TPD at the time, it was felt that because I was doing the start of it wasn't going to fall completely in line with rotations, I was just going to stay where I was from August, because I started my UP in October, and would just sort of carry on in that place on the rota. So I think it made it quite seamless for the for rota admin, and also it was nice for me because it meant I didn't have to get used to somewhere new. But obviously I can imagine it could be different if people are joining on a rotation change. So from my experience, yes, it was just a case of falling into where I would have been anyway, and didn't have to worry about anything, which was very nice. Oh, sorry.
Oh, it's fine. It's fine. That's great. Thank you. So, so I think this is because it's at the outset, and we had, I think, in that particular program, it just fell right. But you don't have to stay in the post, and there may be someone else coming into the next post that you would have been going into. So this is why it's really important that there's a discussion between you and your supervisor about what's going to be suitable and available. And there is the consideration for all trainees without a programme about the capacity of the programme, if you like, to accommodate the need of individuals to go out of programme with the what's called the educational sufficiency of the programme. So if the programme is going to kind of collapse if you leave, then you may not be able to go exactly where you want to go when you want to go. But that's the same rule as it is for all out of programme applications, and that's why that discussion is really, really important. I think given this current period of time we're in, I think we will always try and show discretion wherever possible, because we are in fairly extraordinary circumstances. We have another question coming now, which I think I'm going to put towards Jonathan, and that's is there a way of converting a pending out of programme for experience, which is already arranged, to an out of programme pause? Jonathan.
Yeah. So yes, I mean, there is, I suppose, in that the difficulty with OOP is obviously taking the time out of the programme. And I think if you have the time out of the programme already approved, then you should be able to switch that from an OOP E to an OOP P. The answer is there isn't an official kind of form for doing that, but I don't think that we would have any objection to doing that, and that would be something to discuss with the educational supervisor and head of school. What you can't do without is change the kind of time that you're taking the OOP, so you can't move it forward or move it back, but you could certainly replace an OOP E with an OOP P, as long as, of course, it's a maximum of 1 year. And you have the kind of necessary educational supervision discussion prior to doing it.
Okay, thank you. I think they probably heard you just as the video feed swapped over, so that's great, thank you. And the next question, which I think I probably already alluded to, was will the proportion of trainees going out of programme pause be capped? And I think, as I said before, just to clarify that answer, and I know Jonathan can answer this as well, but I think I'll hopefully answer this. Out of programme pause is not the only form of out of programme. So there's out of programme for research, out of programme for experience, out of programme for a career break, and indeed out of programme for training. programs in their entirety will have all these balances of trainees and flows going in and out, other trainees taking parental leave or other forms of leave, and these all need to be balanced out to make sure we keep the programs as stable as possible, but they are an attempt to try and improve flexibility and give you options. So there's no hard and fast rule about whether they will be capped, but that's why a early discussion with your supervisor is really, really important to try and gauge that for the state of your program. So we'll move on to another question, which I think I'm going to slide towards Jonathan, which is, does the out of program pause have to fit in with changeover dates, or can it be started anytime? Jonathan, what's your view?
No, as long as the programme can manage, it can be started at any time. In fact, because it is a pilot of a year, so there are actually very limited number of changeover dates during that. It wouldn't work if it had to coincide completely with changeover dates.
Okay, that's great. Thank you. So there's a question here which I will read. We'll see how we get on with the answer here, which is, could a similar no pressure scheme be used to help trainees returning from extensive out of programs, e.g. those who have been out of program for more than 3 years? So I think before we answer that, I would say it's relatively unusual for people to be out of program for more than 3 years. It's OOP-R trainees who tend to be out of program for longest if they're doing something like a PhD. On the whole, most out of program periods are between 6 months and about 2 years, with the exception, as I said, of OOP-R. I think another really important scheme that HE offers its trainees is the support, which is the supported return to training. So I think we would probably ask or suggest that you go to that offer first to skill you up, so you're confident to return to the program. Out program pause is not the only option for you to exercise if you want to gain confidence returning to a program. Okay, and our next question is, I think it may have been answered, but I think it's important to repeat this, Jonathan, is out of program pause mainly for those who want to pause for personal reasons? If COVID affects an opportunity in your training and you want to try again? Jonathan.
Yep. No, absolutely. I mean, as I said before, one of the reasons we were keen to roll out the scheme across England was that there'll be a large number of you who have not gained the experience you need to gain, and OOP absolutely is a way you can do that, and then have that experience assessed when you get back into training. So yes, if you're worried about having missed competencies, having not being able to gain the competencies you feel you need to gain in the rest of your program, then OOP is definitely something to consider.
Okay, so that's great. I'm aware we had kind of a slew of questions then, and I think both Kaya and Victoria probably want to just chip in to a couple of those previous responses. So shall we go to Victoria first? Do you want to do, which I think might have been about the timing, Victoria?
Sorry, I just unmuted there. With regards to the timing, yeah, again, I think Kaya and I both started out of rotation time and it wasn't a problem. Just in response to the other question about being out of training for a while, I just know from my point of view, I was given a phased return and given the opportunity to go to a return to training for anaesthetic sort of teaching day. So I was given lots of support just getting back into normal regardless of my OOP. So I don't know if that's what that person was meaning in that question, but I think your deanery and definitely professional support unit were amazing, and my educational supervisor and college tutor, they were all great in ensuring that I had the appropriate training time and a sort of nice slow phase into things, and that was, yeah, separate of my OOP. The OOP was purely just to give me that breathing space and get back to work in terms of training rather than actually getting back into work and functioning after a time away. So yeah, I don't know if Kaya, you want to say anything on that? So
with me, a bit slightly different. I had a regular assessment and meetings with my educational supervisor. And we decided that when I finished my out-of-program post, I would just carry on with the training, but that worked for me. In terms of the timing, again, like with Victoria, I took it in May, and my out-of-program post finished just in the end of October, beginning of November. So that's how it looked with me.
Okay, that's great. So someone's asked, as a paediatric trainee, if one got to experience adult ITU due to COVID, and let's face it, that's happened quite a bit, and want to pause in your paediatric training and some proper experience there, I think that means an adult ITU, would out-program pause be applicable? So Jonathan, do you want to have a go at that? You may not. Go on, off you go. You're
yes,
on mute. Go on.
I'm off mute now. Yes, I think that would be applicable. I mean, it is a break that will get you off the treadmill. There, I would guess, a large number of transferable competencies between adult ITU and paediatric ITU, and you would be able to get those competencies assessed on your return. So yes, I'd have thought that's very reasonable.
Okay, that's great, thank you. So here's a question which I think will help us clear up. Is out-of-program pause only available this year, or will it be available in future too? I think I can answer that. We are extending the pilot, and subject to its assessment, as I think Jonathan may have said earlier, and colleagues may have missed this before if they couldn't join the webinar early on. We're getting a proper assessment of the success of this programme, and subject to that being successful, we would look to be rolling this out more extensively. So it's not just going to stop. It's not going to stop at the end of this year. We would look to extend and roll it out more widely as part of HE's flexibility offer. And you're aware there are other arms of that as well. Okay, so there's a question here about the job offer for OOP-P, and I'm just struggling to find it. Does the job offer for out-of-program pause have to be finalised, as the application is done well in advance of the potential interview process? So yeah, this is an interesting question. So Jonathan, how would you tackle that, would you say?
I could say I'll just ask you the question, but no, I mean, it is because, I mean, again, it is I think the key thing is a process that you will first of all probably decide you want to do OOP and discuss that, and then you will find the likelihood is you'll then find a post that you want to do. I mean, you could potentially do it the other way around, find yourself a post, and then and if you get that post and it's starting in 2 or 3 months, I think actually at the moment the environment is that you're likely to be able to take less than 6 months notice to start that post, just because of the capacity issues within programs. It is kind of, you know, which comes first, isn't it? But I think those are the two possible ways of doing it. Again, Kaya or Victoria may be able to kind of tell us what they did.
I think what we're trying to explain here is that this is a process, and we've had lots of trainees who wanted to go out of program, and the out of program disappears for a variety of reasons. So sometimes that's fellowships are cancelled, or there's a ban on travel, or there are other issues. So going through the process of setting this up, as long as you have a close dialogue with your supervisor and training program director, I think those issues are soluble. If it's been on an interview, it's interesting. given out of program pause is really a chance to really give people the time to step off and think and reflect. And I think Kaya and Toria's kind of testimonies to how they got into out of program pause and what it allowed them to do should give everyone really pause for thought. I'm slightly concerned if you have to go for some super competitive interview, given the parlous state of middle grade staffing often around the NHS. I just think you'd need to be very closely liaising with your supervisors about this, and I'm sure we'd help navigate through that and try and reassure you. I think we've heard that some people think the program's short term. I think we've now said that is going on for longer and it's likely to be extended. We've had an issue about if you have an outcome 3 due to sick leave or mental health absence, but your clinical competencies are met as per the COVID guidance, can you have an OOP and trust grade locum? So if I kick off, and then I think I might well bring in Jonathan to kind of fill a bit more on that. So it doesn't have to be, it can be any NHS facing post. That's what we'd ideally like, because we'd like you to kind of keep up your skills and your registration. So it's not like out of program for a career break, and doing a trust grade would be fine. Doing a locum, I think, would be a little bit more problematic, because I think we're really interested in supervision and safety. And I think most of your supervisors and training program directors and heads of school would be a little bit nervous if you were going from locum to locum, where the levels of supervision are sometimes hard to establish quickly. So I think locums probably that I would be rather cautious of. I think trust grades or local employed doctors, I think with appropriate supervision would be absolutely fine. And again, another reason for having really good discussion with your supervisor. Victoria, do you want to just come in here and say how that supervision kind of angle affected you? So I think that's quite helps illustrate that really well.
Yes, so I believe on our application form to for our OOP, we actually had to state who was going to supervise us. So not only that we had supervision, but that we had a named person had to put those. I found that it was my educational supervisor who just sort of, and the college tutor of the hospital that I was going to be working in were mine. And just to sort of emphasize that, my educational supervisor and I met up and did sort of a type of interim meeting and recorded it on our e-portfolio, just to kind of keep that continuity going, but also as a record to show that I'd kind of had that supervision, even though I was getting the assessments from that side anyway. And then my ARCP actually fell at the end of my period of OOP anyway. So again, that kind of reinforced, and I had some bits and bobs of that, so it kind of fitted it nicely. But yeah, I think you do need to, I don't know if it'd be the same form that was rolled out for everybody, but we had to state who it was, who was going to be our contact as such, and supervisors clinically and sort of on that holistic level as well, I guess.
Okay, so can we get, that's great. I think Kaya would like to add a little bit more just here on that. Over to you, Kaya.
So just mention a bit, contribute to the Victoria's, what she was talking about the supervision. As a part of the application, you had to specify the plan. What exactly are you going to do during the out of program pause? So it wasn't just freelancing and not doing a holiday period, as I would say. It had to be structured because as there's discussion, it might in the future contribute to the CCT. With me, one of the plans was try to achieve is the obstetric module signed off from one of the anesthetic modules signed off, which I would not manage, which I managed to do that. So yes, supervision and a plan.
Okay, that's great. So that's superb. Thank you. That's really helpful from both of you. So I think there's just some clarification. I think, as Jonathan had said in his introduction to how to program pause, you need to be on what's called a satisfactory trajectory, which means usually you should be proceeding along a kind of outcome 1. I think if your CCT date has not been put back, so you might then be on a 2, that would be another opportunity to discuss. I think if you've got an outcome 3, that usually means actually the supervisors and your program think you need a bit more time under the supervision of the program. So we wouldn't normally think an OOP would be suitable at that juncture. So once you're back more on track, it might be, but at the point where additional time is required with the supervision of the program being available to you, we wouldn't think that would be your first choice. So look, we're coming to the end. It's now gone 8 o'clock, and you've been listening patiently and asking some really great questions for the past 60 minutes or so. So I would like to thank everyone who's been on the call. So I'd like to thank Victoria and Kaya particularly for their really helpful illustrations of what OOP was to them and how it helped. I'd like to thank Bill Allen from the Academy of Medical Royal Colleges as their Chair of Flexibility for explaining how it fits. I would like to thank Jonathan, who's the program lead, and there are people behind the scenes here that you don't see. So I'd like to thank Helen Barrett and Liz Hope, who do all the really hard legwork to make this thing go out. I would like to thank all of you, most importantly, for actually logging on and listening tonight. I think that's been, I hope it's been helpful, and we've helped explain some of the ins and outs of this new form of outer program. If you found it useful, let us know. We're looking at the possibility of running more of these on other subjects, so it'd be good to know whether this was useful and if you'd be interested in other topics. Remember at the start we said there is going to be a guide to outer program pause, and that's going to be released very shortly, and that will include guidance on the application process, the gap analysis tool and the return process. So I hope that will be very helpful. And there will be further information or as FAQs available from local offices as well. As I said, we are having this evaluated by academic partners, and we hope if it's successful, we'll be able to extend it. And if you keep checking our social feeds for further updates, further guidance and further webinar, you may be able to join future topics. So thank you very much indeed for joining us tonight. I hope you have a lovely rest of the evening, and wish you well. Thank you.